Hi Professor, my name is Gunu Singh and my student ID is 107699233 and I'm going to perform head-to-toe assessment, and here is 360 view of my room. Hi, my name is Gunu Singh and I'll be your student nurse for today. How are you?
I'm good.
Okay, can you tell me your full name?
Devasish Devi.
Your date of birth?
14 June 2001.
Okay, and can I see your ID, ma'am? Okay, thank you. So today I'll be performing head-to-toe assessment on you as it was prescribed by your doctor. Are you comfortable with
Yes,
that?
sir.
I'm performing hand hygiene and I'll maintain privacy. So I'll be starting with neurological assessment. So Divya, I'll be checking your level of consciousness. So can you tell me what time is now?
11 o'clock.
Okay, and where you are?
At home.
Who I am?
My student nurse.
I can see she's oriented to time, place and person. Now I'll be checking your perla. I'll be flashing light on your eye and you have to focus on a distant object. Okay. Now I'll be checking consensual response of both of your eyes. The same way I'll be flashing light on your eye and I will check the response of the other one. Okay. Divya, you have to focus on the tip of this pen. Try not to blink your eye and don't move your neck. I'll be moving closer to your okay, in different directions also. Okay, thank you. So I can see her perla is equal, round and bilaterally reactive to light and accommodation. Now I'll be checking facial droop, slurred speech and pronation drift. So Divya, can you smile, raise your eyebrows, close your eyes? Okay. So facial droop is negative. So now you have to repeat some words after me. Can you say kitchen, chicken, bed?
Kitchen, chicken, bed.
Okay. So slurred speech is also negative. Now can you stand? Raise your arms like this, close your eyes and repeat, say up to 5.
1, 2, 3, 4, 5.
Okay, thank you. And pronation drift is also negative. Now I'll be proceeding towards respiratory assessment. I'll be starting with inspection. I'll inspect interior and posterior aspect of lungs, and I can see she is breathing comfortably, normally, even, and there is no labored breathing, no use of any accessory muscles, no nasal flailings. Now I'll be auscultating the lung. Usually there are 10 landmarks on the interior side and 12 landmarks on the posterior. But I'll be checking only 6 interiorly and 8 posteriorly. The way you have to take deep breaths, and I'll be starting with the apex of the lungs. Okay, can you turn? Okay, you have to continue taking deep breaths. Okay, so now I'm done with auscultation. There were no adventitious sounds, lungs were clear, there was no wheezing or crackle sounds. Now I'll be checking the symmetry of the lungs by placing my hands on the lower aspect of the lungs. You have to take a deep breath. Okay, so her lungs are bilaterally equal, and now I'll be checking tactile parameters. Divya, you have to say 99.
99.
One more
99.
time. Okay, so vibrations are present equally bilaterally in both the lungs. Now I'll be proceeding towards cardiac assessment. I'll be checking the heart valves, starting with aortic, which is present on the second intercostal space towards the right sternal. Only aortic valve is on the right side, else other valves are present on the left side. So this is aortic valve. Next is pulmonary valve, which is located on the second intercostal space towards the left sternal border. Then on the third, there is Erb's point. It is also located on the left side of sternal border. Then next is tricuspid, which is located on the fourth and fifth intercostal space towards the left sternal border. And next is mitral valve, which is located on the fifth intercostal space towards the mid-clavicle line, and now I can hear the apical pulse. Now I will count her apical pulse for 30 seconds. Okay, so her heart rate was 40 beats per minute for 30 seconds, and for full 1 minute it is 80 beats per minute. So there were no abnormal sounds like murmur S3 or S4. I only heard S1 and S2. Now I'll be proceeding towards abdominal assessment. Can you lie down? Okay. I'll be starting with inspection. As I had checked before, there were no scars, lesion or any kind of mark on her abdomen. There is no bulging mass. So I'll be starting with auscultating all the 4 quadrants, and I'll start from the right lower quadrant and I will move in a clockwise manner. I can hear all vowel sounds in all quadrants, and they are normoactive. Now I'll be doing palpation in the same manner. Divya, if you will feel any kind of pain, then just tell me. Okay, so her abdomen is non-tender, there is no rigidity, there is no abnormal mass or hernia, nothing like that. So we are done with abdominal assessment. Now we will move towards integumentary assessment. So I have checked her skin. There is no lesion, no mark, no scar, and there is no sign of cyanosis. And now I'll be checking her body temperature bilaterally. Okay, she is warm to touch. Now I will check the skin integrity by pinching the skin bilaterally. Okay, as I can see, the skin went back immediately. Now I will check, is there any kind of pressure sore or pressure ulcer on the most prominent areas. Okay, I can see there is no redness, no scar, nothing. Okay, so Divya, can I see your hands? Okay, your nail beds are pink. Now I'm checking capillary refill. I will put some pressure on her nail beds to check how long it will take to refill. Okay, so capillaries are refilling in less than 2 seconds. Now we'll be proceeding towards musculoskeletal assessment. Divya, can you raise your arms? Okay, and now you can raise your. Okay, thank you. Now can you flex your hand towards yourself? Now away. Okay. Now again, can you flex? I'll be putting resistance, and you have to resist. Okay. Okay. Same with your legs. Okay. Now I can see her strength in upper and lower limbs is 5+, and she was resisting when I was putting some pressure. Okay, now I'll be checking your pulse. I'll be starting with carotid, which is located near to the trachea, anterior to the sternocleidomastoid muscle. I will check on the both sides. Okay, so it was palpable, 2+ and regular. Now I will move towards posterior. Now I will move towards posterior tibial artery, which is located lateral to the medial malleolus. Okay, I will check it bilaterally. Okay, again it's 2+, regular and palpable. Now the last is tibial dorsal pedial artery, which is located on the highest point of the metatarsal and lateral to it is our artery. Okay, so again it is also 2 plus, palpable, regular, and the strength is 2 plus. Yeah, I have mentioned earlier also. Now I'm done with my head to toe assessment, and again here is 360 view of my room.